Welcome to another edition of the Let's Be Frank Show. My name is Frank Mentone, and I'm the publisher and president of the Totoket Times. If you haven't seen our show before, our object is to familiarize our viewers with some local people, local town people, local businesses, and just let you sort of meet the candidate. Not candidate, but meet whoever we have on the show, and hopefully when the show is over, you'll be educated in some way in whatever we're talking about. My guest this evening is who just started the North Branford Family Chiropractic and Wellness Center. It's Dr. Mark O'Loughlin. Welcome, Mark.
Thank you.
Welcome aboard.
Thank you. Thank you for having me.
Mark is a chiropractor. He's a couple of months, a month. How long have you been in North Branford?
With the business, about a couple of months. I just opened.
So
yeah,
it's new business.
New business. Yeah.
So the first thing maybe I want to ask is to talk about what exactly is chiropractic care. I'm going to ask you like three questions at once,
Sure.
and you can answer them all.
Sure.
Because if the people who watch know, I usually ask questions and sit in the back, and my guest just talks for a half an hour. What is chiropractic care? How did you get into it? When did you decide you wanted to do it, and things like that?
Well, chiropractic care is a natural alternative health care. Primarily, doctors deal with the spine and the nervous system. I was introduced to chiropractic care at a very young age. My dad used to go see a chiropractor when I was very small, so he used to take me along for his visits, and didn't know much about it then, but it was always sitting in the back of my head for a very long time. And it wasn't until later on in my life that when I decided to pursue an education that I started to think about chiropractic care, and then I started to research it a little bit more, to understand it a little bit more, and that kind of drove me more into the direction to where I am now. Yeah.
Okay, so you were young, you decided. My dad worked in a factory, so I decided when I was young that I didn't want to do that.
Yeah.
So I guess we're all guided by our parents.
In some way, sure.
So what does a chiropractor do?
Well, a chiropractor, again, we deal with the nervous system and the spine. So initially, what a chiropractor would do would be to do an extensive history on a patient. A full exam consisting of orthopedic neurological testing. We do diagnostic testing, x-rays, MRIs if needed, to come up with a diagnosis, what's going on with the patient. The initial response to all those diagnostic testing and exams is to rule out any pathological problems right from the beginning, and to see if a patient can do chiropractic care, can do it. So after all that is done, what we do is we evaluate our diagnostic testing, and we look for misalignments in the spine that could be causing any kind of interference in the nervous system. Because with the philosophy of chiropractic care is that any kind of interference in the nervous system, it prohibits a person from functioning at their best and healing. A lot of times patients will come in with back pain and neck pain, but it's more about finding out what's going on with the nervous system and correcting the problem.
Okay, now the difference between a chiropractor and a general practitioner. I know we were talking before the show started. Years ago, my brother, and it's many years ago, it's probably 30 years ago, did something to his back, couldn't walk, and he went to a general practitioner who referred him to a surgeon, and I think my brother was in his 40s. Like I said, it was a while ago. I don't remember the exact dates, but the surgeon told him that if he didn't get an operation soon, within 2 years he'd be in a wheelchair. And at the time he was in his 40s, and one of his buddies said, why don't you go to my chiropractor? He'll take a look at it.
Sure.
And he went to the chiropractor, and I think 2 times, and he never had a back problem again, and obviously was never in a wheelchair. And so what's the difference? And I'm not saying anything bad about doctors or chiropractors. I mean, that might have worked in reverse at one time, you know.
Sure.
But what's the difference between what a doctor would do and what a chiropractor would do?
Well, the medical profession is a little different philosophy than what we have, and their goal is to find a diagnosis and find out what's going on, as we do. But their standard of care, what they do is, you know, they're from what I understand, and because I'm not a medical doctor, is they try to treat a condition in a different way that we look at conditions. We look at conditions as a biomechanical assessment for the patient. You know, again, spinal misalignments causing interference in the nervous system, allowing the body not to function as best and well as it can, or heal. And so their course of treatment is mostly pain medication and anti-inflammatories and things like that. Where we're more of an active healthcare concept, where we help the patient adjust their spine, get their body functioning better, do nutritional advice, give them exercise protocols, things to do on their own to help them achieve a lot better outcome.
Now, what is the education involved in? When I went to high school, I went to Notre Dame High School in West Haven, and I had 5 kids in our class became and back then it wasn't a, you know, people weren't jumping to become I mean, this was 40 years ago,
right?
And there was still a little bit on the fence about chiropractors and everything, and 5 of them, and I still. 2 of them moved out of state, but I still see 3 of the names in town, not in North Branford, but in Connecticut, in the area.
Right.
What's the education involved to do this?
Well, today it's definitely changed, I'm sure, from back then. But most schools require a bachelor's education, and then there's certain other requirements in the science field that a person must have. There's organic chemistry, chemistry 1 and 2, organic chemistry. There's about 8 different specific requirements on top of a bachelor's degree, and then somebody would apply to a chiropractic school, and that's 4 to 5 years of training in school.
Oh, okay. So there's so you go to college, you get your degree, your college degree. You lean towards a certain number of courses that you have to take, and then. You go to a 5-year school after 4 years of college. Well,
most schools are 4 years. Some do it in what they call tri-semesters. I went to the University of Bridgeport, and theirs is a traditional. Their program down there is a traditional 2-semester year. However, they extend the semesters a little bit longer than the regular college courses. So usually 4 years. And then you have to do an intern. Well, you don't have to do an internship, but we do an internship within the program itself. So yeah, it's 4 years. Some schools are 3.5 years, but it's a lot of hours.
And once again, my guest is Dr. Mark O'Loughlin, and he started the North Branford Family Chiropractic and Wellness Center in North Branford on Route 80. And another question is, okay, you just started this about 2 months ago. Yeah. Where was Dr. Mark before this?
Before this, I was working as an associate for about 4 years out in Cheshire with Dr. Luigi DeRuba. That's really, it's funny because you go to school and you learn the anatomy and you learn all the x-rays and you learn everything there, but it seemed like you don't really truly grasp chiropractic care and what it can do and how it could benefit people until you go out in the field and you start seeing actual people. People coming in with back pain, neck pain, headaches, post-surgical, pre-surgical candidates, and all sorts of conditions. And I was exposed to that. I had the opportunity to see all that with Dr. DeRuba for 4 years. So that really gave me the foundation that I needed to do what I'm doing now on my own. Yeah.
Now, chiro, again, it sometimes gets a bad rap. Mm-hmm. But again, I went 40 years ago when I was going to school, and I see all my friends. I got 4 or 5 guys going into it, and the big thing back then was it's not safe. It's not safe. You guys are crazy. It's not safe.
Right.
Is it? I mean, obviously,
it's been.
You're not going to tell me it's not safe, but
well, no. I mean, I can only say what the research says,
right.
And you know, a lot of the research that's been done, and there's doctors that are constantly doing research. It's very safe, it's very effective, and there's many different types of adjustments. You know, most people come in, almost everybody that comes in say, I want to get cracked. You know, they associate the adjustment with a crack. And that's only because in the back of the spine there's joints back there called facet joints that retain fluid and gas. And when you move a vertebrae in the spine, it creates a cracking sound. So you're not really cracking anything. We're just moving vertebrae into different positions to try to get a better alignment. But it's very safe, it's very effective for everybody. I mean, I've adjusted young children, older people. There's different types and methods of adjustment. So it's not always the same type of adjustment for everybody, depending on different conditions and the age of the patient. Seen a lot of pregnant women, very effective for women who are pregnant to go through chiropractic care during the term of their pregnancy. They have a much better pregnancy and a much better labor when they deliver their baby, birth.
So you basically go from, what's the youngest? I mean,
you know, we've seen children in the office a couple days old, week old, and where a lot of doctors would say it's very unsafe to do that. But the conception is that you're thinking that an adjustment is a hard force, but that's, like I said, there's different types of adjustment for different types of people. So you would never do an adjustment that hard on a little baby, but you could definitely. And there's and we've had a lot of conditions where kids came in and they had torticollis, which is their neck was twisted from the birthing process, from the doctors trying to take them out of the mother, and it's a misalignment in the spine. And with a couple of adjustments, gentle adjustments, sometimes we have to use an instrument called an activator, and to realign the spine to get them to correct the condition.
So you're talking about like babies that are babies, you know, infant babies.
Yeah, infant babies, sure. Yeah.
Wow.
Oh,
so
yeah.
You go from
it's incredible. Yeah.
3 months to 100 years old.
Yeah, like I said, when I was in school, you don't obviously get that experience. Right. But when I was out in the field working with, you know, Dr. Darubha, you know, you get to experience and you see that, and that's when you really grasp chiropractic, I think, and you really say, wow, this is, you know, look what this did to these people. Look at what this, you know, it's amazing. So. Yeah, it just gets me more excited to be in this field.
Yeah, I have to get your card before you leave, because the way I walk sometimes is my daughter gives me exercises to do, and she's an athletic trainer.
Right.
And you know, I'm doing the exercise, and I'm saying, gee, we got a problem here, because you're not giving me exercises for a humongous man who's old. Yeah. You're giving me exercises for your high school kids, and I can't do any.
Well, no. Well, you have to tailor your protocols to the type of the patient. You know, so exercises that I would give to you would be much different than I would give to somebody.
Yeah. Well, she lays on the floor and says, "Do this." Well, first of all, if I get on the floor, we have to call a tow truck to get me up. That's if I can get there in the first place. But so you have different, you know. Obviously, different procedures for different sizes and shapes and ages and things like that.
And different tables. You know, we have what's called a high-low table, which goes up and down, which aids a lot of patients, because a lot of patients can't get down on a table, or even if they're down, they can't get up off a table. So it makes it a lot easier to have a table that stands up, where a patient could just stand into it, and the table would bring them down and bring them back up. And that helps in the adjustment. And there's also features on the tables that allow us to do a little drop work. So there's different types of adjustments. It's not all manually by your hand.
Now, do you have that table that they have on 2.5 Men, where you stick your face in the hole and?
That was actually a bad representation of chiropractic.
I
That's a massage table.
I didn't think that was something you wanted to.
Yeah,
but
because I watched that show, and that actually drew me to that show a long time ago. I used to, because he was a chiropractor, first time I saw it, and I used to watch the show all the time. But some of the things that he does in there are definitely a bad representation of what we do as a chiropractor.
I would think so. Yeah. That would get people not to go instead of people to go.
Oh, yeah.
And so how exactly? I mean, you align them, you turn their neck. I mean, I'm a novice, so I have no idea. I mean, I always go by the thing crack, you know, oh,
Right.
they cracked your back, and, you
Right.
know, you yelled and you walked out and you know, jumped around and said, you know, I'm free.
Well, besides the different modalities that we could use to do the adjustment, we also have different adjustment procedures. That's probably the way I should have said it before. So the type of adjusting, what we learn in school is more diversified adjustment, but the type of adjusting that I do in my office and I learned from Dr. DeRuba is more of what we call a Gonstead adjustment. This was developed years ago by Charles Gonstead, and it's more specific, segmental specific. In other words, we're looking for the one or two vertebrae that are misaligned, and we're just adjusting them. And the adjustment is very specific and in a very specific direction, so it's very safe. Yeah.
Okay, so
So there's different techniques. And like I said, again, the table helps and aids because we could use a lot of drops to get the adjustment. There's a lot of different ways that we can adjust a person's spine.
now I went online and I'm checking out this because I don't know anything about it. So, and usually I don't do this because I don't, you know, I'm lazy. I don't. But I kept seeing the word, and I know how it's spelled, subluxation. It kept popping up. What is that?
Subluxation.
There you go.
Basically,
I can't even say chiropractic. I'm never going to be able to say subluxation.
a subluxation means that the vertebrae is misaligned, putting interference in the nervous system, and so it's subluxated. It's out of position, and that's what we're looking for as we go through our examination procedures and our diagnostic testing, is we're looking for those vertebrae that are subluxated, that are misaligned, causing the body not to work right. And those are the vertebrae that we concentrate on, and those are the vertebrae that we adjust. Yeah.
That's all it is. Why can't I find that out
all it is.
online? Now, I know in some chiropractors that even advertised with me in the past and might still advertise with me. They do a lot of stress stuff. Mm-hmm. Do you get into that, or are you just? I mean, they do. One of them does acupuncture, and they do what's the word? Hypnosis and stuff. Sure. Is that part of? Is that something in addition that they do? Do they have to go to special school to add that onto their, you know? Well,
there are to do acupuncture. You do have to go to school.
Right.
There's courses that we could take, continuing education courses that we normally, as doctors, we would take to continue to maintain our license. But to become and learn acupuncture, yes, you have to go take. There's a course out there, 100-hour course, and then there's classes you could take to further that, to do more in the body. But those are all added to what we normally would do. Most chiropractors don't do a lot of that stuff. Some do, but I don't.
Now, does back pain? Because I'm reading up on this because my back has been a mess, and most people tell me the reason my back hurts is it's tired of carrying my front. Mm-hmm. But is there is some of it mental? Is it, you know? And do you deal with that, or is that something entirely different?
No, you know, a subluxation, most people don't even know they have a subluxation. Now you're starting to feel back pain, and you probably have had back pain for a while. And when you start to feel back pain, it means that something has been going on for a very long time. And now it just pushed the envelope, and now you're at a point where you're really starting to feel it. Your body's starting to realize it. That's why we do an extensive history. We want to go back. We want to look at, you know, any kind of accidents, any kind of falls. We want to see if there's any kind of medication, because that's a stressor to the body too. You know, chemical medication in general. So, you know, that could all be contributing to what you're feeling now. What you're feeling now is the fire alarm's going off, but the fire's been burning for a long time.
That's a cute way of putting it. Yeah.
We try to use analogies whenever we can. It makes it a little bit easier.
My fire alarm's going off. I had for a while I had lost my real job, and I was umpiring about 350, 400 games a year, and it used to tighten up like in the second or third inning. and then it would loosen up after an inning, and then I'd be good for the next 4 games. And then when I got out of the car, my wife would have to help me walk into the house. But
yeah, because of your body, what your body's doing is when your spine is under a lot of stress and a lot of those tissues and nerves are under a lot of stress and it's misaligned, the body naturally reacts and starts to muscle splint. It's a guarding mechanism. The body's telling you, hey, look, something's going on here. Don't move, and it spasms, and the muscles, so it's locking you down, and that causes a lot of pain.
Yeah, because I'd be doing there were days where I did 4 games, and I'd be doing the game, and I'd be in the first game in like the 3rd inning, and I'd be like, I'm not gonna be able to finish this. I got 4 games this afternoon,
Sure.
And then all of a sudden, it would loosen up or do whatever it does, and I'd finish the 4 games, and it wouldn't even bother me the rest of the games, and then. So I get out of the car and I'd call my wife saying, I need to get in the house, I'm stuck.
And then the body also, once the muscles start to guard like that, you start to set off a lot of chain reactions inside the body, so you get a lot of inflammation. So the best thing to do would be to put ice on it, about usually 15, 20 minutes with an ice pack on the area, and then remove it. And then try to move around, try to get some motion into the body, because the body thrives on motion. So.
See, I actually didn't tell you the reason I have the doctor on the show today is so that I can get a lot of free advice and maybe feel better. I'm going to go home right now and put ice. My son was an athlete, and when his ankle hurt, I could never do this. My daughter told me to do it. He would take a bucket of ice and stick his ankle in there and just keep it in there for like 20 minutes. And I was like,
it's a great way to do ankle sprains, to reduce the inflammation with the ice bucket. However, 20 minutes is a really long time because that's direct on the skin like that. I would have just probably said do it about 5 minutes or so. And
he was in high school. He was crazy.
Great,
they probably told him 5 minutes, and he figured if I keep it in 20, it's going to be a lot better. Yeah. Now, does it just, and you might answer this, but sometimes I doze, is it just back? Or is the back the center of do you address any other?
Well, we do if there's a need, but it starts from the nervous system, what we call the neuromusculoskeletal system, and the nervous system is what controls and regulates all body functions. So it's there that we go to the cause and see what's happening. We don't really try to chase the symptom. For instance, if I'm having a digestive issue, or if I'm having heartburn, or a headache, or something like this, I mean, we'll address that in the initial examination and try to rule out some key factors there. But we're going to go right to the spine. We're going to go right to your history. We're going to see if there's any accidents, falls, what you do for a living, and try to look for the cause and the misalignments in the spine right there, because that's the source. That's where everything communicates from.
So basically, with the back one, it's sort of a wellness. I mean, obviously the name of your place is Wellness Center.
Yeah.
How does the chiropractic aid take care of my overall wellness?
Well, once we get the patient to get them out of pain, find out what the problem is, start to give them a little bit more adjustments in the beginning. And that's the reason why chiropractors usually recommend a little more adjustments in the beginning, is because whatever's been going on, it's been going on a long time, and 1 or 2 adjustments sometimes doesn't take care of the problem. But repetitively over the first 3 or 4 weeks makes a big difference, reduces the pain on most patients, and then we could start to proceed to do some more less frequent adjustments. And once we get the patient stable into a point where the patient is out of pain and he's not into an acute situation anymore, but he's into more of a different care, then we could just recommend once a month or once a week, a little more frequent visits, or less frequent visits, so that the patient can maintain their health status at that point. So you don't need to see them. And that, by getting yourself checked every once in a while, helps the body regulate and function better, and that is more of a healthcare, preventative healthcare, than to wait until you feel sick and go see your medical doctor and get prescription. That's, to me, seems like more crisis care, more sick care.
Well, that was going to be my next question. So you went right into it. My back hurts.
Yeah.
What do I do first? Do I go to a medical doctor, or do I go to a chiropractor first? Then I don't know if you can really answer that, but I figure you can answer better than me, so I'd ask you.
You know, most patients, it's hard to say because a lot of patients will immediately, let me call my medical doctor. And you know, and then some patients who have had previous chiropractic care might say, let me call a chiropractor. Because I know they're back specialists and they're gonna do the best they can. And some people might ask their friend, hey, what do you think I should do? And they might say, look, you know, why don't you, refer you to us. So it's really a matter of choice, and I think a matter of public awareness. A lot of people don't understand really what we do. And if they did, and if there was more of that going on, then there would probably, less people at the medical doctors and a little more people at the chiropractor's office, because we're trying to get you well. We're trying to get you quick. We want to get you back doing the things you love to do. We're not trying to keep you as patients. We want to get you back functioning better and out there doing what you love to do.
And plus, in most cases, the chiropractic, that's you're probably more equipped than just a general, and I'm not knocking general practitioners, but I go to my regular doctor, and I know you were talking before the show, you take blood pressure readings and all that stuff, so it's basically, and you focus in on that. Now, if you focus in on that, are there times when you have to recommend that you better see a doctor?
Oh, sure, a lot of times. If I see something, some red flags pop up, then I'll recommend, maybe I'll send them out for an MRI, or maybe I'll send them out for some further diagnostic testing and try to get an understanding of what's going on here. And if I need to send a patient to an orthopedic or their medical doctor even, or somebody else that's more equipped to handle the condition, I do it right away. Yeah,
okay.
Yeah, definitely.
All right, we're coming down the home stretch. Anything else we need to add? Again, my guest is Dr. Mark O'Loughlin. He started in North Branford, the Family Chiropractic and Wellness Center. We don't have his number on the screen, but if you want to call him with any questions, you're in the book, obviously. And
yeah, sure. Anytime.
You can see it in Totoket Times, and not just for an appointment, but to ask a question. He may be able to help you out on the.
Sure. I'm always available. Anybody could call me anytime. If I can help in any way, I would definitely there for that. Sure.
Obviously, if you've watched the whole show, I know some people turn it on in the middle. So I go back. If you've watched the entire show, obviously at the beginning of the show, we talked about why he's a chiropractor, and obviously likes what he's doing, because he's done this. It wasn't like he was in college and said, like I was, I don't know what I'm going to do. 4 years of college, I was going for teaching, and then I decided I didn't want to teach the last semester, and I said, oh my God, I got to think of something to do. But obviously, if you listen to the beginning of the show, he's wanted to do this since he was a kid.
Yeah.
So it's not something he had to do to feed his family. It's something he has a passion for, and that's a good thing. So, welcome to North Branford.
Thank you.
You've lived in North Branford, right?
I moved down into the area about a little over 10 years ago, into Branford, and my girlfriend just bought a house. She's from North Branford, so she just bought a house, and we just moved up here just about a year ago now. We moved last September, so yeah, I'm here now.
There you go.
Yeah,
so,
I'm here to stay.
Welcome to the town.
Thank you very much. I
thank you for being on the show.
Thank you.
And
it's a pleasure to be here.
Maybe down the road we might be able to get the doc to come on his own, maybe once a month or once every quarter, and just talk about the chiropractic needs and things. We're trying to get more people from the town to do their own shows. Sure. So that's it for now. I'm going to thank our Director Michael Valenti, and until next time, we'll see you in the road.
Yeah.
Thank you.